So here's what the hip looks like. It's a little bit different than the knee. It's more of a ball and socket. So you hear about ball and socket. This is it. Here's the ball. There's the socket. Oftentimes people go like this when they come in the office. They go, my hip hurts. And they go like that. And I'm like, well, that's your back. But doc, my hip hurts right here. I'm like, well, okay, that's your butt. But my hip hurts right here. Well, that's your butt and your back. So your hip joint, most people don't realize, is right here, right in your groin. Okay? So if I'm going to stick a needle in somebody's hip joint, right there, that's where it is. So oftentimes people say it's my hip, and they go like this, or they go down their leg, and oftentimes the back masquerades as the hip. So again, that's why you got to talk to your doctors and try to figure out really where the pain's coming from. But classically, people with hip joint pain complain of pain in their groin. It's the #1 cause of the hip joint pain is arthritis. 70 million people have some form of arthritis. 70 million, I mean, that's huge. How many people have some form of arthritis? There's two types that we often see. You hear about the bone-on-bone arthritis that you all have talked about. Osteoarthritis, or good old-fashioned wear and tear arthritis. That's all in this category right here. You hear about the other type, the rheumatoid arthritis, and that's the type that younger people get. It's more deforming. You see it on their fingers. We're not really talking about that. That's certainly the minority of patients that have rheumatoid arthritis. It's a different disease. This is a disease of the end of the joint where you wear off the lining of the joint. This is a disease of the linings around the joint. This one is much more successfully treated with medications. So you'll hear about people that get Remicade shots or long-term medications. Rheumatoids do better on long-term medicines, whereas the osteoarthritic are the ones that just wear it out and there's not a whole lot they have left. But these do really well with reconstructions. So this is what a healthy hip looks like. Again, same concept. There's a lining on the surface of the bone. If we wear that lining off, we know what to call that, right? That's called arthritis. So if you look at this one, you can see it's worn the lining off. It becomes inflamed. These are called bone spurs. So you get bone spurs that the body forms on that, and there'll be cysts in there. And again, the same thing. You can wear bone against bone. People don't like that. They hurt. Same thing on the hip. Is it really bothering you? Do you walk with a limp, or does your family member say you walk with a limp when they're walking behind you? Is it difficult to do activities? Go to the walk, go to the grocery store. How about with hips, it really becomes evident that, oh, I always get manicures or pedicures because I can't do my own. Or the spouse helps somebody put their shoe or sock on. Those are classic hip findings that they'll ask when you talk about it. Do you go to the zoo and you look for a place to sit? Do you feel like you're limping or one leg is longer than the other? They'll say that all the time. They're usually not longer, but they feel like they are. Are they able to balance? And so I tell people to balance all the time. Even if you don't have hip problems, you got to work on balancing. Okay? Helps prevent hip fractures. That's something that's important as well. Do you have pain? Again, you know the answer on this. In the buttock, the thigh, or the groin. #1 place is the groin, right? That's where they'll get the pain. And does it hurt if it goes down to your knee? Sometimes the hip will refer to the knee, just like the back can refer in there as well. Rate your pain. How is it affecting you? Because I get all kinds of word pain, right? I get some farmers that say, well, it's just a little ache, doc, you don't know, and they're off going again on the combine or whatever. I have other people that say it's excruciating pain. So I don't know what the word pain is. So I try to, again, relate it to either a number, where it's the worst pain you've ever had, or how is it changing your life? I hurt at night. I have to put pillows between my legs. I can't go to the grocery, or I limit my grocery trips, or I limit going to the zoo with the kids. I mean, I had one lady who came in a week or so ago. It was vacation time, and guess what? They're going down to see Mickey down in Orlando. She had the grandkids, and she wasn't going to get it. We were getting that knee done like ASAP, because her motivation was that she wanted to ride the rides and walk around Disney with the kids. So everyone's a little different there. So you usually find what the trigger is for them. Same thing with hips. What can we do? We can use analgesics, such as the medications. I really try to keep people off narcotics. So pain medicines that are addictive, I really try to get away. If we're going to that, it's obvious we need to get something done, because you can get addicted, it can mess with your colon, it can make you nauseated and lethargic. So I really keep people off narcotics if I can. Injections, again, you probably heard my slant. I'm really not a big thing of steroids. You can do the lubricants, but here's what the FDA, you guys all heard about the FDA. The FDA will not allow us, quote unquote, on label to inject these medications in the hip. They allow it in the knee, but they won't allow it in the hip. But a lot of people say, hey, I'll pay for it out of my pocket, let's try it. So you can do it, but you have to pay for it out of your pocket. It's pretty expensive, so it's rare that I get people that want to jump with that. Water therapy, again, I love water therapy, especially warm water therapy. And again, exercise, try to work on the weight loss. Bicycles are a great thing because you're not weight bearing and you're getting these things moving. So I love movement, just like the water aerobics. Not stressing the joints, but moving them. So hip replacements, you'd be surprised how many people walk right by you that have them. Huge numbers of people that have them. Again, we just replace the surface. We don't cut out all the ligaments and muscles. We just put in new pieces where you're rubbing it raw. You're looking at over 250,000 a year on those. This is what it looks like. So this is the stem part. This is the part that goes in the thigh bone, and this is the socket. Remember I told you it's a ball and socket? So the ball rubs into the socket. This is the stem. So I have one of these, and I'll show you what it looks like. You can pass it around, but you can see there's the ball and socket. Classically now, we do most of these what we call non-cemented, meaning that they go into the bone and the bone grows into it. So it's meant to be there for your lifetime. The old days, you used to get cemented hips. It's not as common that we do that. It's pretty rare actually anymore. And how does it work? Because we get rid of this area, you remember, where it was all raw and the bone had worn away. So this is the only thing we remove is that little piece of bone right there, and we put all this grows inside the bone. So we're not cutting huge segments out. I mean, we take about that much out and then replace it with what you have in your hand. And then it's locked in there. They're up and walking. Different types of bearings. You might hear about this sometimes if you're up late at night. The attorneys are putting stuff like this on the news, on hips that work or don't work, and this is what they're talking about. It gets a little confusing. Usually they're marketing and looking for issues. The hip works great. It's a lot better than the knee, and again, people forget about their hip. Same kind of questions. Should you wait? Depends on how your function is. If you're losing sleep or hurting or limping or grabbing that grocery cart, you might want to be thinking about it. If you're blowing through your medicines, I'm hurting even though I take Advil or Tylenol, I'm just not getting any better. It depends on your quality of life. And again, it will not get better. It doesn't have a rejuvenating property, meaning you can't wait 6 months and it get better. The x-ray is going to look the same or worse. Now what you can do is make yourself better by losing weight, getting your diabetes under control, and getting more active. So recent study, 600 people after the hip, 96%, this kind of goes back to what you were asking, 96% that they're able to move better with more freedom and more pain. 90% said they were able to do their favorite activity. For golfers, they're handicapped with hips. Again, that's kind of a little trivia fact that I'll ask the residents and such. Their handicap stays the same with the hip. So in summary, number one cause of hip pain, arthritis, osteoarthritis, not the good old-fashioned wear and tear. It's degenerative. The sooner you get after it, the longer you can hold off and the better you can be. Arthroplasty, if it's indicated for you, can help relieve the pain and hopefully get you more active. So that's hips in a nutshell.